What is spinal fusion surgery for adult scoliosis? Spinal fusion surgery is part of traditional scoliosis treatment. And traditional scoliosis treatment is the treatment that I'm talking about that's normally managed by an orthopedic surgeon. Scoliosis causes the spine to bend unnaturally to the side and also twist. And this twist is into the concavity of the scoliosis. Spinal fusion involves fusing the curve's most unnaturally tilted vertebra into a solid bone. This most often uses metal rods that are attached to the spine to help maintain its alignment and stop the vertebra from becoming more tilted and twisted over time. This is what we call scoliosis progression. Adult scoliosis can typically progress. As a progressive condition, we know it's in its very nature to worsen over time. Now, typically progression is associated with growth in adolescent cases. As patients go through rapid growth, it means that their curve has a potential of getting bigger with them. And therefore, scoliosis progression is always associated with the curve increasing. However, adults are not going through rapid growth. However, their curves can still progress, and it tends to progress slowly over their adult life, increasing speed as the curve gets bigger and as they get older. And the rate of progression is typically associated with their total curve size. In a later adult life, the curve can start to degenerate abnormally, which can cause the curve to start progressing faster. And this can lead to more severe pain and more severe discomfort as a result of the increasing unbalanced nature of the scoliosis. Now, like all surgical procedures, any surgery comes with risks, but when we look at spinal surgery and fusion, especially one associated with something called scoliosis fusion, this can be particularly risky. Risks associated with the procedure itself can include things like nerve damage, infection, adverse reaction to the hardware, and excessive blood loss. The risk of surgery only increases with age, so the older the patient is as they go through surgery, the more likely they are to have a negative reaction. And one thing that is true that once your spine has gone through complete fusion, it is fused for life. There is no undoing fusion. Now, some patients can have the rods and screws removed. However, it's more complicated to remove the rods and screws than it was to initially put them in. So therefore, most patients do not have those removals occurring unless there's some kind of hardware failure. But normally they're removing hardware and adding more. So if the fusion's unsuccessful, typically complications typically develop, and normally the recourse is more surgery. And the more often you have surgery, the increased risk associated with each surgery increases. So not only is there additional risk, the risk associated with the surgery and procedure itself, but there's also long-term effects that patients have to be very aware of. And sometimes these long-term effects are unknown because there's not a lot of data long-term regarding scoliosis fusion, especially in the adult population. Now, when we look at some of these long-term risks, what are some things that are just obvious? Well, we know the spine that is fused is contrary to its natural movement-based design. Therefore, it will be less flexible, it will reduce range of motion, and it will have an impact on the activities and quality of life. And this is a fact because as you remove motion of the spine, you're going to impact some of these things. In addition, adults can also experience increased back pain at the fusion site. So when they have scoliosis fusion, the area that's fused can have more pain and more discomfort, and it can be also very significantly start to affect the function of the area. The older the adult is at the time of spinal fusion, the more lengthy the recovery period is, and again, the more risky the surgery tends to be. Now, does every adult case of scoliosis need surgery? And the truth is no. Many cases of adult scoliosis respond well to non-surgical treatment. In fact, most scoliosis surgeons don't want to do scoliosis fusion on adult patients unless it's a last resort. They're normally going to recommend some type of conservative treatment before that. However, your choice of what type of scoliosis treatment that you use really can dictate how well your body responds to the conservative treatment that you actually are performing. And also, the earlier that you're diagnosed and the earlier that you treat the scoliosis, the better. What ends up happening with most adult patients is they're told to do nothing. And they're told just to let the curve continue to worsen and worsen and worsen over time until it becomes severe enough and the problems become bad enough to now start considering scoliosis surgery. We recommend treat the scoliosis in its milder form and treat it conservatively. Therefore, you prevent the curve from progressing because early detection and proactive treatment is definitely the center of all modern non-surgical conservative treatment options. And the goal of conservative treatment is really to avoid the risks of surgery to begin with. So therefore, keeping the curve small, preventing the spine from getting worse, and keeping the spine balanced and stable is really the utmost importance. Now, treatment plans are typically fully customized when it involves treating a scoliosis conservatively, but typically involves scoliosis-specific chiropractic care to work on curve reduction. Normally also includes physical therapy and scoliosis-specific exercises that can help improve balance and strength around the surrounding muscle tissue that helps support the spine. It may also include corrective scoliosis bracing to help reduce the spinal curvature, improve the shape of the body, and decompress the spine. And it also may include rehabilitation that can involve customized prescribed home therapy, in-office therapy to help hold long-term results. Now, the goal of adult scoliosis treatment here at the center is to improve the spine's balance, stability, and strength, reduce the size of curve, and really try to avoid patients ever facing the potential risks that are associated with spinal fusion. Thanks for watching. I hope you found this information helpful. If you have any questions about this topic or other scoliosis questions, type in the comments below and let us know. And finally, subscribe and hit the bell icon to be notified of when we publish new videos just like this.